Okay. So I'm charged with also introducing our speakers this morning. I'm going to start with Dr. Siddharth Agarwal, who's a physician from India, and he's been working for over 20 years with slum dwellers in India and around the world. He's the founder and director of the Urban Health Resource Center in Delhi, which works with over 500,000 slum dwellers in partnership both in research and action. He's been involved in the government of India's National Urban Health Mission, which is a very interesting program and one I think that has a lot of lessons about what can be done at the national down to the local level. He's an adjunct faculty at Hopkins in the School of Public Health and the Department of Global Health, and at George Washington University. And I was glad to host him at UC Berkeley many times to work with our urban health group there. He's also advised the WHO Center for Health and Development in Kobe, and the past president of the International Society of Urban Health. Thank you, Dr. Agarwal.
Thank you to all the forum members for inviting me. It's an honor to be here and share certain experiences from my brief work in urban slums, mostly in India, but also experiences from elsewhere. So these are some of the populations that we are talking about, just glimpses so that we all have a similar idea of the types of approaches that we'll see. Some more glimpses. These are particularly women and children, and this is the situation they are in despite the fact that they contribute with very low wages to growing GDPs, which are becoming increasingly urban. And why is this critical? A less healthy and less nourished workforce is contributing to the GDP. So if the workforce was healthier, the developing countries in particular would have faster and more thriving economies. Another fact is that the pathogens continue to thrive in suboptimal environments. And the urban component of GDP of most developing countries is growing very fast. And inequalities have been discussed in this meeting at length. And urban populations as well as slum populations are also growing very fast. The last point is what I would want everyone to pay a little greater attention to, is that it's important to invest in slums despite there being many unknowns when we try and invest either in the form of an action research or time-bound funding, because most of these research and funding is risk averse. And we are talking about populations living at risk. So this is something to think about, whether we continue to remain risk averse or we take a more brave and courageous approach, since we are dealing with populations who themselves are leading their lives at risk. This is the first method, which is a qualitative assessment that drives action in slums. And here you see in these 4 pictures how the women's groups members are assessing the conditions across several neighborhoods or several slums. And this is how they are assessing on charts using the red, yellow, and green dots, which is, some of you must have heard about the Urban Heart or the Urban Health Research and Equity tool of the WHO. So this is a qualitative adaptation of that instrument, and this straight away drives action. So the second method is the action itself. One of the ways that have been useful is for communities to have petitions to the local authorities, the municipal corporations, and reminders of the petitions, maintain a paper trail. And these petitions are usually for the environmental conditions in slums, such as water supply or sewerage system. And that is why these need to be done, because government resources should come to these settlements, which are usually ignored. Women's empowerment is essential because we live largely in the global south in a male-dominated society, probably also in other countries. So this segment of the population can contribute to overall caring and infection prevention at household and community level. A group fund, here we use the word social needs fund. It started with a health fund but broadened into a social needs fund. These are managed by the community groups themselves, and they are trained how to maintain records of loans that are given for various situations. For example, improving the housing conditions, constructing a toilet. Investing in the next generation is always useful, and particularly in countries like India where the young population is very large. So children and youth groups also are contributing to this effort, and they hopefully will be the next generation to work on this in the coming decades as well. Having a voter ID gives them greater power to express themselves before political leaders. So this is another approach that we have used. Linking livelihoods, we were talking about several sectors, bringing them together. So linking women particularly to livelihoods that can work either in the neighborhood or from home is very useful, because then they have more resources to take care of health and well-being in the family, of children. The eighth approach is listing and mapping all slums, which includes the listed and unlisted. Here you see the blue dots, which are the listed slums in a city called Meerut, which is about 80 kilometers or 60 miles from Delhi. And now you see the red dots, which are the unlisted slums, and this is the complete picture. This is a map with health facilities and slums of the city of the Taj Mahal. And this slide shows the significance of identifying the unlisted. And this may be dismissed as the data from a civil society organization, but the government statistics in the line at the bottom itself also shows that a large proportion of the slums are not listed. Neighborhood mapping can actually track recent migrants and particularly at-risk populations. As we were discussing yesterday, that all populations in slums are not identical, so there are certain more vulnerable groups. This approach was discussed. I just wanted to share this because this shows that the disparities are not similar in all provinces of India itself. So when we look at the disaggregated data at country level, we get some picture, but when you look at the state level, for instance in India, you see that in some states the situation is better, and in some states the disparity is worse. This is another similar situation about housing, and this has implication directly with infectious diseases, because higher density would increase the risk of all respiratory diseases. We found that the risk of tuberculosis is twice as much in people living with more than 5 persons per sleeping room as compared to those living with less than 4, which is still not the optimal as advised. This is the multi-sectoral forum that we've encouraged to be promoted at either city level in small cities or at the zonal level. But wherever the municipal governance is not as strong, the health department has also taken the lead. So you have the urban primary health center level committees which bring together different stakeholders so that they can talk about how to improve overall well-being and health and reduce the risk of infectious diseases. This slide essentially shows that while India does have an urban health policy, it took a long while. So these are 4 different documents which emerge at different points in time. And the rollout is more important than just having a policy in place. So here are some glimpses of improvements. You can see the sewerage line being laid. This was the unpaved street, then the sewerage line is being laid, and this is after this street is paved. This is self-explanatory how the efforts of slum women's groups have had this effect of getting garbage cleaned. Improved water supply, again, the slide says it all. Improved electricity supply. This is a slightly busier slide than this was the situation, and it slowly kept improving till in 2015 they had a more permanent bridge over this drain, and this impacts the lives of 120,000 population, all slum population, who live across this drain. So this is how I would wish to end. Let us build human capability, self-reliance of slum dwellers, help them voice their circumstances. It's their voice which is more crucial than our voice. And it's important to translate words into real action, because as I was showing, India does have a national urban health mission, as it is called. It's like a policy document, but the implementation has been very slow. So that we have real action towards infectious disease prevention in what are becoming, or at least being called, smart cities. And this group is a very diverse group, so I thought Helen Keller said something which applies to all of us. Together we can do quite a lot. Thank you.